My name is Dr. Art Malone. I'm a consultant psychiatrist specialised in adult eating disorders. I work for the St. Vincent's Adult Eating Disorder Service. We provide outpatient, inpatient and liaison, so in-reach to medical admitted patients for St. Vincent's Hospital. I'm also the chair of the College of Psychiatrists Eating Disorder Special Interest Group, and I'm the adult consultant psychiatrist representative on the National Clinical Programme for Eating Disorders Oversight Group. Eating disorders are a group of complex mental illnesses which are characterised by abnormal thoughts and behaviours around eating, which tend to result in abnormal eating patterns, abnormal ideas about your own body image, and typically result in physical impairments as well as psychosocial impairments. Ultimately, what eating disorders are, they tend to evolve as a sort of coping mechanism for people who are trying to cope with the stresses of life, but ultimately it becomes something that's ingrained, very difficult to shift, and is ultimately very harmful to people who suffer from eating disorders. The eating disorders that we see in our service most typically would be anorexia, because although it is not the most common eating disorder, it is the eating disorder which tends to present with the most severe symptoms, characterised by reduced energy intake, leading to either weight loss, keeping your weight at a very low level, or in people who are still growing, that they just have otherwise a failure to thrive, failure to grow at the rate that they would be expected to. It's characterised by an intense preoccupation and fear of gaining weight or becoming fat, and it is typically, there's two main subtypes of it. There's a purely restrictive subtype where people just have either too little at their meals or eat too infrequently, and there's also a binging and purging subtype as well, which can be characterised by restriction, but also periods of loss of control and overeating, followed by vomiting afterwards. So some people who present with vomiting might be misidentified as having bulimia, but if they have the other psychopathology of anorexia, their diagnosis is anorexia. And it's also characterised by lots of typical sorts of behaviours around food, such as rituals around food preparation and food eating. So food eating may take an extremely long time for people, or they may only eat very kind of small meals or very infrequently, and they also have a big preoccupation with food as well. So lots of their time spent thinking about food, whether it be their next meal or their last meal. There may be lots of preoccupation with food behaviours such as reading recipes, looking at food on the internet, food preparation for maybe other people but not necessarily to eat themselves. It has very severe complications. It's the deadliest of all the mental illnesses, so roughly people are 6 times more likely to die from anorexia than they would be if they didn't have it. It's relatively common, and it typically affects females more than males, but males are also affected as well. Depending on the different estimates, it'd be around somewhere between 1% and 3% of women are affected by anorexia nervosa at some point in their lives, and roughly, maybe 0.1 to 0.3% of males. So it's very common, typically more common among younger ages. The way eating disorders are defined, there's very clear criteria for different types of eating disorders, whether that be anorexia, bulimia, binge eating, or avoidant-restrictive food intake disorder. There's lots of people that are severely impaired, severely distressed by abnormal eating behaviours and abnormal eating thoughts, but they don't fit neatly into any one category. So this is a group of people that would be categorised as having an other specific feeding or eating disorder, but it doesn't quite match the criteria for other specific disorders. So it is, the most common would be other, but it's also an extremely wide and varied group of people, some of whom overeat, some of whom undereat, some of whom are very low weight, some of whom are very high weight, some of whom weight fluctuates up and down, but they're all characterised by extreme distress and abnormal behaviours around eating. So bulimia nervosa is an eating disorder characterised by periods of loss of control around eating. So people report maybe an intention to not eat so much and then losing control and eating more than they expected, or they intended to not eat at all and suddenly they kind of start eating uncontrollably. There's subsequently a period afterwards where they'll engage in some sort of compensation for that. Most typically you might see vomiting, self-induced vomiting, but any sort of compensation that's outside of the normal range would be sort of sufficient to constitute a bulimia diagnosis. So that includes excessive exercise. It could include periods of fasting afterwards, using laxatives or other types of medication to try and alter your weight as well. So we see a range of different compensation mechanisms, but ultimately it's loss of control, compensation, and extreme kind of emotional and psychological distress associated with either or both of those. Binge eating disorder differs from bulimia nervosa because there isn't compensation afterwards. There's the same sense of loss of control around food and eating, and there's the same distress around that loss of control, but there isn't subsequently a period of compensation afterwards. Another eating disorder is often referred to as ARFID, that's avoidant-restrictive food intake disorder. That's a disorder characterized by, for whatever reason, an inability or kind of an unwillingness to meet specific nutritional needs. So it can be quite varied in terms of who might present with that. There's three different subgroups of people. There's people who, for whatever reason, lack internal cues around eating. They lack hunger cues, or their hunger cues have become confused in some way. So they just may not have an appetite at all. They may go long periods without feeling hungry, or they may feel full very easy, so really early satiety. There's another group of people that have sensory problems with food, so that might be problems with smells, problems with taste, problems with the sensation of swallowing, and for that reason they're not able to eat either enough or certain types of food. And then finally there's a group of people that have some sort of specific anxiety around food. This is sometimes a group of people that maybe have either choked at some point in their lives, or witnessed someone choking, or maybe someone that has a phobia of vomiting, or someone that has a phobia of their bowel symptoms. So there's a bit of an overlap with people that have gastrointestinal problems, that because they're so worried about having diarrhea or having constipation that they avoid certain types of food. But the end result is that people either are at a low weight, or else that they can be missing kind of specific nutritional food groups. So they might present with vitamin or mineral deficiencies of some form or the other, and can present really quite sick in the same way that people with severe anorexia can present. The difference is that they don't have the same level of body image disturbance that people with anorexia have, and they would be, if you gave them the option, they would try to restore weight. They just, for whatever reason, are unable to do so. So this is something that is a relatively new term that has only been kind of in use for the last couple of years in kind of scientific literature and as a diagnostic label, but it's something that has kind of always existed, but it's only recently been kind of very clearly described. There is a distinction between eating disorders and disordered eating. So there's plenty of people who maybe don't have the healthiest relationship with food, the healthiest relationship with their body image, healthiest relationship with exercise. And I guess there is a severity threshold where actually if it progresses sufficiently, it would move from a disordered eating to an eating disorder. So there certainly is a problem with people who maybe are a bit too preoccupied with the gym and dedicate too much of their time to it and too much of their self-worth to it. Some of whom may have an eating disorder, but I wouldn't say necessarily that is an eating disorder. And there's also obviously subcultures of people who are involved in exercise that can maybe take it too far, whether that be through using steroids or kind of other unhealthy things that they might engage in, which may be at a level of severity to be called an eating disorder, but also may just be an unhealthy behavior people are engaging in without a kind of full disorder as a diagnosis.